So we'll now start the section on pigmentary disorders, and in this section we'll cover hyperpigmentary disorders, right? Let us see what are the things that determine skin color. So skin color is determined by melanin, right? It is the pigment that is produced by the melanocytes. It is also determined by carotene and by hemoglobin, the blood flowing in the dermal vessels, hemoglobin, right? Now melanin is produced in the melanocytes in the basal layer of our epidermis, right? And it is determined by genetics. The amount of melanin production is determined by genetics and UV light exposure, sunlight exposure, right? What is the pathway of melanin synthesis? Now everybody has melanin. It depends upon the amount of melanin that is responsible for the color of the skin, right? So tyrosine is converted into L-DOPA under the influence of enzyme tyrosinase, right? And then this is converted into dopaquinone, and then this is converted into melanin, which is of two types: the eumelanin, which is of black brown color, and the pheomelanin, which is of yellow red color, right? So this is the pathway for melanin synthesis. Now see, disorders of pigmentation can be due to hyperpigmentation, can be due to two pathologies. It can be due to increased epidermal melanin synthesis, right? Or there can be an increase in the dermal melanin. Now, how is melanin going to reach the dermis? We do not have any melanocytes in the dermis, right? So, how is melanin going to reach the dermis? There can be a pigment drop from the epidermis to the dermis. So, there can be pigment drop from epidermis to dermis, right? There can be ectopic melanocytes in the dermis. Normally, melanocytes are present from in the basal layer. They are derived from the neural crest and they are now residing in the basal layer. Now, if during the migration of melanocytes they get arrested in the dermis, we will have melanocytes in the dermis, and they are ectopic melanocytes because that is not where they are usually found. So you can have ectopic melanocytes in the dermis producing pigment, right? And you can have melanin binding to exogenous pigments. Right? So this is how we are going to get a hyperpigmentary disorder. Now, epidermal melanin synthesis appears clinically as, light brown to dark brown. While this is going to appear blue or ashy gray, dermal melanin is going to appear blue or ashy gray. This is because of Tyndall effect. Okay, dermal melanin will have a clinical appearance of a bluish or a ashy gray patch, and epidermal melanin will appear light brown to dark brown or black in color. If you do a woods lamp examination,